Welcome to Graceful Healing, a podcast to get straight talk about healing and living again. My name is Maureen Lake. I'm a holistic health coach, speaker, author, and thyroid disease fighter. Each week, I'll be bringing you graceful conversations to inspire you to seek new ways to hit the reset button to catapult your health and vitality to new levels. Listen in and open your heart to all the new possibilities. Are you ready? Let's do this. Dr. Stephanie Gray is a pure delight to talk to, and she has more letters after her name than basically the entire alphabet. It's obvious she's incredibly bright from this interview from the moment she starts talking about herself and her incredibly insightful journey, and I so appreciate her willingness to share openly her journey and her healing that now has a total and complete direct impact on how she works with her patients. Dr. Gray's expertise lies within integrative, anti-aging, and functional medicine, but I was able to tap into her expertise about fatigue, something that hits all of us hard, right? Dr. Gray shares some very, very interesting insights about fatigue, the causes, and a lot of possible solutions. You're going to want to listen to this. And I just have to share that Dr. Gray did this entire interview even though her baby was due any minute. Talk about dedication. I know you're going to enjoy this interview as much as I did. Her insight as a medical doctor, working with other women that have chronic illness, is extremely valuable and important to hear. Welcome, everybody. I have Dr. Gray with us today. And the one thing I love so much about her treatment model is that she looks at everybody as a whole person, mind, body, and spirit. And she searches for the root cause of someone's illness instead of just treating the symptoms. I'm so pleased and thrilled for her to share her story with you today and her practice. So welcome, Dr. Gray. Thank you so much for being here.
Well, thank you for having me on.
Awesome. So can you just share a little bit about your personal story and how you landed where you are today? Because looking at your bio, I have to tell you, I've never seen so many credentials in such a young person.
Oh, well, thank you. Yeah.
It's the truth.
Currently, my husband, Eric, and I own the Integrative Health and Hormone Clinic. We're in Hiawatha, Iowa, so we're in the Midwest. And at our clinic, we use functional medicine to, as you just mentioned, help really men and women get to the root cause of their problems. So straight out of school, I knew I did not want to just be stuck prescribing medications. And there is a time and place for medication. Mm-hmm. And maybe I can give you an analogy to kind of compare at least how we describe this to our patients, the difference between conventional medicine and functional medicine. So I went to school for conventional medicine. So unfortunately, that's more of a fire department approach, right? Their two tools are drugs and surgery. And their conventional medicine is really good at putting out fires using drugs and surgery. But I knew I didn't want to do that the rest of my life. And so I did pursue some additional training through the American Academy of Anti-Aging Medicine, just to learn more about what functional and integrated medicine, all these new buzzwords really even meant and how to apply them in practice. So we describe our approach at our clinic as really being more of a carpenter or a contractor approach. We want to help men and women repair and rebuild the body, not just put out fires, but figure out why the fire happened or prevent future fires from happening. And so I've really just used the knowledge, some additional knowledge I gained after school to be able to apply functional medicine principles. And we're getting excellent results. And it's so encouraging to really help free patients out of their illness instead of just managing it with symptoms or with medications for their symptoms.
Right. That's amazing. I love that analogy too. I've never heard that before. That's great.
Thanks.
So if someone comes to you, what's the first thing you do? Do you start with just lab tests or do you dig deep into their history or how do you problem solve to get to the root cause?
Yeah, so a lot of times it takes time. And so we do ask that patients prior to their appointments fill out a pretty thorough, comprehensive, we just call it a new patient packet, where we're asking all of their symptoms, when they started, to try to get a functional medicine timeline going on, right? I want to know what their birth was like. Were they a C-section? Were they a vaginal delivery? Were they breastfed? Did they grow up on a farm? Were they exposed to chemicals, which many of us are living in the Midwest here? Really, we go through the whole life with the patients to try to figure out what the cause of the problem could be. But as you mentioned, yes, we do utilize a lot of different tests. Some of the very common tests that I order would include things like hormone testing on patients, looking for also nutritional deficiencies, maybe doing food sensitivity testing, or looking for toxins within the body. So the testing is determined based on the history of the patient, but also the symptoms that they're experiencing together.
So basically you get to the root cause by looking at their history, correct?
History and, yes, history, symptoms, and labs, I would say. Those are the big three.
Oh,
Yep.
Okay. Great. Because I know in my own personal case, I can pretty much pinpoint exactly, almost to the day, that it was like a tipping point for me where I went from having hypothyroidism to Hashimoto's.
Sure.
And obviously it had a lot to do with stress and some different things that was going on in my life at the time. So, which brings me to my next question, which I know is so common with a lot of my listeners, is like the underlying fatigue that people get with so many different chronic illnesses. And do you have like any recommendations of how to address that or how to talk to your doctor about that? And the reason why I'm bringing it up is because oftentimes as a patient, we get dismissed, like,
Yes.
Oh, it's just this, or it's just that, just get more sleep, but all the things that we're already doing really well, that's not working.
Sure. So really, I might echo what I just said with the testing options that are available, really more from a functional medicine standpoint. But I would say maybe there are 4 different things that I could recommend patients ask their primary care providers if they could help assist exploring. So one thing that's very common, again, in Iowa, here in the Midwest, are nutritional deficiencies. So things like vitamin D deficiency or B vitamin deficiencies. Asking doctors to look for those can be very beneficial. Many patients are on so many medications, like even birth control depletes B vitamins that can drag patients down and make them feel very tired. Beta blockers and blood pressure medications, diabetes medications. All of these medications deplete nutrients, and the prescriber doesn't always prescribe the nutrient depleted by the medication that they're recommending.
Isn't that the truth?
Sadly. So that's one avenue that patients can explore, is really looking to see if they have nutritional deficiencies, or, even just starting a high quality comprehensive multivitamin that's a capsule, or a B complex, or vitamin D. A lot of times our bodies are just starved for nutrients, and that's why our bodies aren't functioning like they should. A functional medicine provider is going to be more familiar with ordering a comprehensive nutritional analysis, but many primary care providers will at least help the patient get started into looking for some of those nutritional deficiencies. Secondly, really looking at food sensitivities. So I know myself, included amongst many of my patients, feels very tired when I consume certain food groups. So dairy, for instance, really drags me down. Gluten makes me feel like I'm on drugs almost. I feel very off. And so many times when we're eating foods, the foods are alerting us with certain symptoms like fatigue, that those foods are not good for us. But we don't always know how to make that connection. And so, logging, maybe having a food journal and experimenting, taking certain foods out of the diet can be very beneficial for patients who are diligent enough to do that. If they're not, finding a provider who can run food sensitivity testing can be very important. Also getting at the fatigue, potential root cause of the fatigue. And then at my clinic, we do offer hormone replacement therapy, not synthetic, only natural bioidentical hormone replacement therapy. And unfortunately, I see women, even in their 30s, very young. Had a patient today who had a hysterectomy at the age of 36. That's around my age. Well, I think that's young. No,
It is.
To have had a hysterectomy. And so looking for hormone imbalances, like low testosterone. Even in women can have low testosterone, which can lead to fatigue, can also be very important. And then lastly, looking at toxins. Sometimes we're poisoning ourselves and we don't even realize it with the skincare products we're using or the foods that we're consuming. Toxins can drag us down and make us feel pretty tired too. So that's a very brief synopsis, but looking at nutrients, foods, hormone deficiencies, and toxins all can contribute to that underlying fatigue you were asking about.
Wow, that's amazing. That's really valuable information, because I know I tend to just kind of buzz along really nicely. And then it's like I hit a brick wall and I'm not really sure what it is. But if I stop to think about it, because the last time was right during the holidays, I was eating a lot more sugar than I typically do. And I've learned that that's really definitely not good for me at all in my energy levels. So you're absolutely right about being really aware of what you're doing all the time, really. I love the fact that you do look at the nutritional deficiencies too, because with our diet today, it's hard to eat a well-balanced meal.
It is. Yeah, that's sad again. The nutrient content in food has been on the decline really since the 1950s. So, what was contained in our soil years ago no longer remains the same. So if our soil is depleted in nutrients, then the food that comes from the soil is also going to be more depleted in nutrients. So really, a kale salad today isn't going to have the nutrient content that it had decades ago. So it is really hard to get from food what we really need for our bodies to function appropriately.
That's so true. Gosh. What drove you to get into this area? Like, was it something like, I'm assuming you knew that you wanted to be a doctor, but once you started learning the traditional medicine, that something was just lacking? Or I'm just curious what brought you down this path of functional medicine.
Yeah, so I'm really blessed to have been raised in a family. My parents weren't hippies, I would say, but they were very just health conscious. My parents were self-employed, and so we always had a very high deductible. So my parents never wanted to take us to the medical doctor, right? Per se, they wanted to keep us healthy. So we were always taking our vitamins. We were always going to the chiropractor. We were always engaged in physical activity. Just raised in a really health conscious family who I think my parents were almost ahead of their time. So that set me up to kind of desire to, continue with those habits. And I almost went to chiropractic school because I really appreciate chiropractors and they've helped me a lot through my life. But I felt like, I'm actually very happy that a patient that I had seen in school had given me a magazine article through the American Academy of Anti-Aging Medicine. I think it was an advertisement for a conference. And so I went to the conference and I was sold. I said, this is exactly what I want to do. I knew I wasn't going to learn those principles through my schooling, but after school, I decided to gain some additional knowledge. And I did obtain a master's in metabolic nutritional medicine as well. So I think I just always had this desire to look at things a little differently. I wasn't raised in a family who always, took their children to the doctor for antibiotics when they were sick. I was really raised in the opposite manner. And so that was a blessing to me. Yeah,
I'll say, because I definitely was brought up even with raising my own children, antibiotics were really handed out like water.
Yeah.
And now, we know so much more. So that's awesome.
And that's the sad part, trying to tie this to a concept you're asking earlier about the fatigue. So many patients now I see with chronic fatigue from yeast overgrowth, which can be a manifestation of all the antibiotics that they were, prescribed for decades of their life, whether it was for respiratory illnesses or acne or whatnot. When you take antibiotics wipe out all the good bacteria, and then opportunistic yeast can overgrow, and the yeast can just drag patients down and make them feel very tired. And sugar feeds yeast. And so the only way to get rid of yeast is to, back off on its food source, cut off the food supply. And really, you can take antifungal supplements and medications, but also repopulate your gut with good bacteria, with probiotics. So, even taking antibiotics in the past could be a cause of current fatigue.
Wow. That's pretty fascinating. And it's interesting because I know clients of mine that have gone to the doctor and asked for their opinion about probiotics and prebiotics. And they're just kind of like, well, you don't need to be doing all that stuff. And it's just crazy. It's almost like, go back to school. You don't know what you don't know, I guess.
It is pretty sad that unfortunately with conventional medicine, a lot of doctors don't get any training in nutrition. They may get one lecture. And like they're going to remember that if it was from 20 years ago.
Exactly. One other quick question about your practice. When you say that you work with mind, body, and spirit, I'm just curious what type of advice you give. Like, do you recommend meditation or journaling or any of those type of things with your patients? Or
Absolutely. So one of the most important things and part of my story through the book that I wrote also, one of the things that really benefited me was stress reduction, like you alluded to earlier as well. And so what I discovered kind of through my journey, I now, of course, try to apply to my patients more so than I did before. I didn't used to focus as much on stress reduction, and now I certainly do. And so, yes, meditation is very important. I think deep breathing has really helped me just to calm my nervous system anytime I have to publicly speak or if I'm having a stressful day, whatnot. I try to incorporate the deep breathing. I mean, that's a free activity that anyone can do for their health. And stress impacts, really all chronic disease. It's your biggest hormone hijacker. Stress is bad. Stress is the process of our health. And so probably managing stress is the most important recommendation that I can have for my patients. And so, yes, meditation, deep breathing, yoga, calming activities, not always intense, cardio, are really what would serve the patient better with more stress in their life. And of course, we recommend, we have supplements that can help manage that as well. But stress reduction is a crucial component of what we recommend here.
That's great. So you mentioned your book. Can you tell us a little bit more about that?
Sure. So I'll throw in a little bit more about my health struggles here. So I already mentioned that I was blessed to be raised in a very health conscious family. And so, I really thought I had great health. And for the most part, I did. But stress was working against me. I went to school full time for a very long time, and I started my practice, and I had a lot on my plate. And about at the age of maybe 30, sitting at my desk, my heart rate took off really fast. I didn't just have palpitations. I had what's called tachycardia, very fast heart rate that landed me in the emergency room. And, at that point, conventional medicine's solution was to take a medication to control my heart rate, which, I almost gave into because having a very high heart rate can be scary. I ended up losing some weight, and I couldn't sleep. I couldn't lie on my back. I was exhausted and dizzy and becoming very tired, and I still had my practice I needed to manage. And so, as tempting as it was to take a medication, which was really only going to be a Band-Aid approach,
right?
I knew that I needed to kind of treat myself the way I treat my patients. I needed to try to get to the root cause of the problem, stress being one of the triggers for me. And about this time, my husband, who's our office manager at the clinic, said, I think we need to create a blueprint. I think we need to clarify all of what we do here at the clinic, because it is difficult, even in a podcast like this, to really share all of what functional medicine can do for a patient. So I decided I was going to create a blueprint to work my own health through to try to get to the root cause of my fast heart rate. And then I would also have this blueprint that would really clarify our message to our patients as far as all of what we can offer them, what solutions would be there for them. So that's a little bit more about my story and why I wrote the book, but I can talk a little more about it if you want me to.
I'd love for you to. Absolutely.
So throughout the book, I'm comparing, my book is called Your Longevity Blueprint. We all want to age well, right?
Oh, yeah.
So throughout this blueprint concept, I'm trying to compare our home to our body. Many of us know how to maintain our homes. We are mowing the lawn, right? We're changing our furnace filters. We're keeping hair out of our drains. We don't want to clog the plumbing or whatnot at home. They're just things that we do on a daily, weekly, quarterly basis, maybe without even thinking about it. But we're maintaining our home because we want the home to last a long time. And the same is true for our body. We all want our bodies to last a long time, but we don't always know what to do to maintain them. We know, okay, we should eat healthy. We should try to reduce stress. We should exercise. But there's so much more to health. And so I'm comparing in the book different organ systems in the body. Like with chapter 1, I'm comparing our gastrointestinal system to the foundation of the home. So I'm comparing one piece of the body to one piece of the home. So the foundation of the home is the most important piece of the home because it has to support the entire weight of the house or the house is going to crumble. So the same is true with our gastrointestinal systems. And many patients don't realize how important maintaining good gut health really is. A lot of autoimmune diseases stem from our gut. We need to keep inflammation down. And and keep good bacteria at a good level there, not having like the yeast overgrowth I just mentioned. So that's what chapter 1 is about. But then I go through 9 chapters just comparing various parts of our house and how we maintain them to various organ systems in the body. And some chapters apply more to some patients versus others. Chapter 6 is all about, I'm comparing the heating and cooling system of the home to the endocrine system or your hormone system within the body. So obviously that many times applies strongly to women and men who are middle-aged, maybe more so than the younger, population. But I wanted to make sure I included various chapters, various steps in this blueprint because, for some patients, the gut health is all they need, whereas for others, they may have already seen functional medicine practitioners. Maybe they've gone through half of these steps in the blueprint, but their issues are so complex. Maybe they have Lyme disease or mold toxicity or heavy metal toxicity, whatnot. So I wanted to make sure I included a lot of hope for patients, a lot of potential solutions that may be something they haven't looked into yet.
It sounds like something that everybody should read that has some type of chronic illness.
Yes, I would definitely agree.
Yes. And they can get the book on Amazon, is that correct?
Yep. Barnes & Noble, Amazon, pretty much everywhere books are sold. And you can also purchase them off our website at yourlongevityblueprint.com. And there's a book trailer video there. And that's where all my blogs are. Some other beneficial free information is provided there as well.
Oh, perfect. And I'll have a blog post and send this out in my newsletter too to everybody to have all your links available so that they can just click right there and find your stuff. It sounds to me like I need to get your book too. Anybody probably needs to read a chapter or two and try to figure out what's really going on. It's fascinating the way that you used the analogy for that too. It makes so much sense, comparing your body systems to your home. I like that.
Thank you.
You're welcome. So just to sum up, what would you like, what's your big takeaway for people that may be struggling, don't know how to find the right answers or ask the correct questions of their doctor? They have a list of symptoms, but they're really kind of global symptoms. Like, how best can a patient talk to the doctor so that what information is the doctor really looking for from a patient to help try to problem solve things? Because I just feel like so many times we come in with like a list of symptoms and the symptoms could just match anything, any type of illness under the sun. But are there certain questions that might be helpful for doctors to know?
So I would love it if my answer was as simple as, just being able to provide a simple piece of information that a patient would need to provide to their doctor that could just, can really change their health. Unfortunately, many doctors I don't want to say that they're not open-minded, but they just haven't had the necessary training. So they're offering the patient all that they can. If a patient, we'll go back to that fatigue again. If a patient has fatigue, they might run a blood count and a kidney and liver function panel just to make sure the patient checks out okay. But the patient's then told their labs are normal and the provider doesn't have much more to offer them. So I might have to alter my answer a little bit to say, I think the best answer would be to find a functional medicine provider who's going to think outside the box. And in the last chapter of my book, I talk a lot about that. You have to find someone who's going to be on your team. Right. You may have a very nice, loving doctor who's very smart, but if they don't have the appropriate training, there may not be, anything that you can necessarily say to them that will help them fix you. I think really finding a functional medicine provider who can help you rebuild your health, or as I say in the book, personalize a plan, really to rebuild that house of yours or that body of yours, then you might be kind of like a hamster stuck on a wheel. Those are a lot of the patients that I see. They've already talked to their primary care provider several times and they're not making progress. So finding a functional medicine provider, which you can do by going to the Institute for Functional Medicine or the American Academy of Anti-Aging Medicine's websites, searching the provider directory with your zip code may be the best option for you to find someone closest to you to help you.
And that's exactly how I found my provider, because just going through Google search on the internet, you're not necessarily going to find the right type of doctor, but using either one of those services, and it's incredibly valuable to find this specific type of doctor that you really want. And it made all the difference in the world of my healthcare as well. So that's really great advice. So I always ask everybody at the very end of my interviews this one question. And so here you go, Dr. Gray. What's one little piece of advice you'd tell your younger self if you could go back in time?
It's so hard to just pick one. But knowing, again, kind of the high stress that I have been under throughout my life for various reasons, I think just taking time to stop and deep breathe, like I was saying, stop and smell the roses. I've been passionate and driven, and there's nothing wrong with being that way. We need a lot of those movers and shakers in life. My biggest life lesson learned has been to take time for myself, for self-care, to really focus on the present, because that's all we're guaranteed. We're not guaranteed the future, and there's no point on, being depressed about the past or, again, anxious for the future. Mm-hmm. So really just to live in the moment, live in the present, take time to deep breathe, which stress reduction really would be the most important thing. I wish I would have mastered at a younger age, but I'm very thankful to have at least, started incorporating it this decade of my life.
Oh, that's perfect advice. Gosh. I think that's probably something all busy women wish they'd go back and tell their younger self that same thing. Well, thank you so much for being on my show today. I can't wait for the audience to hear, especially the tips that you shared about fatigue. This is going to be huge for so many listeners. I really appreciate you sharing that.
Wonderful. Well, I do want to offer 10% off our website. Any purchases for books or supplements using the code, we'll keep it simple. We'll just say thanks healing. That's a little shorter than thanks graceful healing. So we can use the code thanks healing. So I encourage you to check out our website. Like I said, our blogs are there. Other podcasts I've been on are there with some useful links and tools.
Oh, thank you so much. That's incredible. I appreciate that. I'll make sure that the listeners get that code as well as all the other tips and strategies that you're offering and a link to your book. Sounds fascinating. I'm going to go out and buy it right now.
Well, know that there's hope. If you're listening and you've been frustrated, not being able to find answers, they're out there. You just need to find that functional medicine contractor or provider who, again, can help you rebuild your health. Mm-hmm. Help is out there. Yeah,
that's great. Thank you again. It's been wonderful talking to you.
Thanks for having me on.
Bye.
Oh, thank you so much for joining me today. This episode is brought to you by my book, The Graceful Advocate, Taking Control of Your Life After a Diagnosis of Thyroid Disease. You can find it currently on Amazon. I love it because my friends call it a purse book. They keep it with them when they go to the pharmacy, grocery store, or even to the doctor's office. It's a great little guide to keep you on track and informed. I can't wait for next week when I get to see you back on the pod. Thank you for listening. I really do appreciate you so much. If you ever need someone to chat with about your healing journey, don't ever hesitate to reach out to me through my website at maureenlake.com.